So this is a multidisciplinary committee. It's non-clinical in nature. So most of the people who are on the committee are actually more operational. And so that really has helped us to establish kind of our objectives, or, kind of reflect our objectives, which are we needed to be able to establish the business support and the feasibility of being able to onboard one of these agents, as well as coordinating the reimbursement challenges that often come with these, making sure there's always an authorization in place prior to, having a patient. And then also just doing that proactive financial assessment and determining the impact so that we're not, having to deal with issues on the back end. And so those are kind of the objectives of the committee. Like I mentioned, it is multidisciplinary. We set some review criteria in place. So high cost agent is the obvious one. We set ours at about $300,000 per patient or annualized. Or if we're seeing like a product that has a large number of patients, our committee also is looking at really anything could come to us, things that have high logistical needs. So if they have, lots of special equipment that we need to purchase, or, anything like that. Like our presentation primarily is focusing in on those cell and gene therapies, because I think that's a very hot topic right now, but really any drug could technically come to us if it's determined that those needs are required. And, we really felt like a pharmacist is the best position to be able to help lead these efforts, because we naturally already interact with a lot of the elements that are in the committee. So the stakeholders, if you will. So, contracting and the clinics and the infusion center where these are administered, the revenue cycle, procurement. And so we kind of already naturally have that encompassment of, the stakeholders interactions are already kind of taking place, whereas others, wouldn't normally interact with those on a daily basis, in a way. So anyways, that's kind of why this was created. And then UC Davis decided that they would create an emerging therapies pharmacist. And so that's actually my role currently, is to be that person who's helping to kind of facilitate and coordinate some of these interactions with the stakeholders.